Imagine a vibrant, sharp-minded grandmother who's always been the heart of family gatherings. Recently, though, her family notices she's forgetting names, struggling to follow conversations, and seeming confused in familiar places. They worry it's dementia, but when her doctor carefully reviews her medication list, a different story emerges. Her cognitive decline isn't dementia, it's drug-induced cognitive impairment, a documented and often reversible condition. Today, I want to ensure you and your loved ones understand this critical distinction. Medications play a vital role in managing health, but some can affect memory, focus, and clarity, especially in adults over 60. This conversation is one I wish more doctors had with their patients before prescribing. Let's explore how this happens and what you can do about it. Imagine your mind is a perfectly tuned instrument, until one day, the notes start slipping. Misplaced keys, forgotten appointments, or struggling to recall a neighbor's name. For many, these changes trigger fears of dementia. But there's another culprit, the very medications meant to help. Over 100 commonly prescribed drugs, from antihistamines to sleep aids, even certain blood pressure pills, can cloud cognition, especially in older adults. The reason? These medications often disrupt acetylcholine, a neurotransmitter vital for memory and focus. The good news? Unlike dementia, drug-induced impairment can often be reversed. The first step is awareness. If you or a loved one experience sudden mental fog, don't assume the worst. Review medications with a doctor, asking, could this be side effects, not decline? Sometimes, adjusting doses or switching prescriptions restores clarity, proving it wasn't your mind failing you, but chemistry. This isn't about fear, it's about empowerment. Knowledge turns a whisper of worry into actionable hope. Word count 175. As we age, our bodies change in ways that can make us more sensitive to the effects of medications. By the time we reach 60, our kidneys and liver don't process drugs as efficiently as they once did. This means medications can linger in our systems longer, potentially increasing their impact. Additionally, the blood-brain barrier, which acts as a protective filter for the brain, becomes slightly more permeable with age. This allows certain drugs to cross into the brain more easily, where they can interfere with critical neurotransmitters like acetylcholine, which plays a key role in memory and learning. These changes mean that medications, even those that are generally safe for younger adults, can have a more pronounced effect on cognitive function in older adults. It's not that the medications are inherently bad. They're often prescribed for important reasons, but the aging brain simply handles them differently. This conversation is one I wish more doctors had with their patients before prescribing. Let's explore how this happens and what you can do about it. New content. Beyond medication processing, aging also alters body composition. Fat increases while muscle and water decrease. This shifts how drugs distribute in the body, with fat-soluble medications accumulating over time, prolonging their effects. Older adults often have multiple chronic conditions, leading to polypharmacy, taking 5+ medications. This raises the risk of harmful drug interactions, where one medication amplifies or cancels another's effects. For instance, common pain relievers like NSAIDs can reduce kidney function further, worsening drug clearance. Another overlooked factor, reduced stomach acid production with age, affects how pills dissolve, altering absorption. Some medications, e.g., thyroid drugs, may become less effective unless taken with adjustments. The nervous system also grows more sensitive. Even low doses of sleeping pills or antihistamines can cause confusion or falls. Proactive steps. Request geriatric medication reviews. Prioritize non-drug therapies, e.g., physical therapy for pain, and ask about deprescribing, tapering off unnecessary medications. Small adjustments can significantly improve safety. Let's talk about something that doesn't get enough attention: how certain medications can temporarily cloud your thinking, making it seem like something more serious is happening. What you're experiencing might not be dementia at all. It could be something called drug-induced cognitive impairment, a documented medical condition where medications interfere with how your brain processes information. The symptoms can be surprisingly similar to dementia: memory gaps, trouble finding the right word, confusion about time or place, even changes in personality. But here's the key difference: unlike true dementia, this condition often improves when medications are reviewed and adjusted under a doctor's supervision. Think of your brain as a finely tuned network of signals. Some medications, especially in combination, can disrupt those signals. Certain drugs block acetylcholine, a neurotransmitter essential for memory and learning. Others may cause excessive sedation, slowing down your brain's natural clarity. The good news? When the medication balance is corrected, many people notice a real difference in their mental sharpness. This doesn't mean your medications are bad. they were prescribed for a reason. But as we age, our bodies process drugs differently. What worked well at 50 may need adjustment at 70. That's why regular medication reviews with your doctor are so important. If you've noticed changes in your thinking after starting a new prescription or increasing a dose, that's worth discussing. Not to stop necessary treatments, but to explore whether adjustments could help you feel clearer and more like yourself again. When you take 5 or more medications, what doctors call polypharmacy, the risks don't just add up, they multiply. Each new prescription increases the chance of unexpected interactions, especially in the aging brain. Think of it like stacking dominoes. One may be harmless, but several together can create a cascade. The brain is often the first place subtle warning signs appear. A word on the tip of your tongue, a task that suddenly feels confusing, a flicker of forgetfulness that wasn't there before. These aren't necessarily signs of dementia. They could be your nervous system signaling that it's working harder to process multiple medications. Some drugs amplify each other's effects without anyone realizing it. A sleep aid and a bladder medication, for example, might both dampen the same brain chemicals needed for clear thinking. That's why regular medication reviews with your doctor are so important. If you've noticed changes in your thinking after starting a new prescription or increasing a dose, that's worth discussing. Not to stop necessary treatments, but to explore whether adjustments could help you feel clearer and more like yourself again. The human body isn't designed to manage a chemical cocktail. Beyond memory lapses, polypharmacy can trigger physical symptoms mistaken for aging, unsteady balance, dry mouth, or blurred vision. Some medications deplete essential nutrients like magnesium or B vitamins, worsening fatigue or nerve function. Even common over-the-counter pills like antacids or allergy meds can interfere with prescription drugs. Surprisingly, the gut microbiome, a key player in immunity and mood, is also disrupted by long-term medication use, potentially leading to digestive issues or heightened inflammation. Silent risks, like internal bleeding from NSAIDs combined with blood thinners, often go unnoticed until an emergency. Doctors sometimes prescribe new drugs to counteract side effects of existing ones, creating a cycle. The solution? Bring a complete list, including supplements, to every appointment. Ask, is this still necessary? Could a lower dose work? Small tweaks often restore clarity without sacrificing treatment benefits. Let's talk about a hidden challenge many older adults face: medications that quietly interfere with memory and focus. One of the most concerning categories is anticholinergic drugs. These work by blocking acetylcholine, a key neurotransmitter for learning and recall. Think of acetylcholine as your brain's messenger for forming new memories. When its signals are dampened, mental clarity can suffer. These drugs aren't rare. They're found in common allergy medications, certain bladder control prescriptions, and even some older antidepressants. Research suggests that long-term use, especially in those over 60, may correlate with gradual cognitive changes. It's not an immediate effect, but over months or years, the cumulative impact can become noticeable. The risk isn't about any single prescription. It's about stacking multiple medications with this mechanism. An allergy pill here, a bladder drug there, and suddenly the brain is navigating a fog it didn't have before. That's why regular medication reviews with your doctor are so important. If you've noticed changes in your thinking after starting a new prescription or increasing a dose, that's worth discussing. Not to stop necessary treatments, but to explore whether adjustments could help you feel clearer and more like yourself again. Many older adults reach for over-the-counter sleep aids without realizing these medications could be affecting their daytime clarity. The active ingredient in most common sleep drugs, diphenhydramine, is actually a strong anticholinergic agent. While it may help you fall asleep, it continues working in your system long after you wake up, potentially leaving you feeling foggy or forgetful the next day. Prescription sedatives present similar concerns. They're designed to calm the nervous system, but in older adults, they can linger in the body far longer than intended. The brain struggles to shake off this chemical dampening effect, making it harder to concentrate, recall words, or stay alert during normal activities. This doesn't mean sleep issues shouldn't be treated. Quality rest is vital, but it does mean we should be mindful of how these medications interact with an aging brain. If you've noticed yourself feeling unusually groggy or mentally sluggish during the day after using sleep aids, that's worth mentioning to your doctor. There are often alternative approaches that can improve sleep without compromising cognitive function. The key is finding the right balance, addressing your need for rest while protecting your daytime sharpness. That's why regular medication reviews with your doctor are so important. If you've noticed changes in your thinking after starting a new prescription or increasing a dose, that's worth discussing. Not to stop necessary treatments, but to explore whether adjustments could help you feel clearer and more like yourself again. Now let's talk about benzodiazepines, medications often prescribed for anxiety or sleep, like diazepam or lorazepam. These drugs can be very helpful in the short term, especially during acute stress or insomnia. But here's what concerns me as a doctor. When older adults take them regularly for months or even years, the risks begin to outweigh the benefits. Research shows long-term use is linked to memory lapses, slower reaction times, and a higher risk of falls, a serious concern for seniors. The brain adapts to these medications over time, making them less effective while increasing dependence. That doesn't mean they're always harmful. There are situations where they're necessary. But if you've been on them for a while, it's worth discussing with your doctor whether a gradual, supervised reduction might be possible. Never stop them abruptly. That can be dangerous. The goal isn't to scare you, but to highlight that there's a middle ground between staying on them indefinitely and quitting cold turkey. If you've noticed fogginess or unsteadiness since starting one of these medications, that's a conversation worth having. Together with your doctor, you can weigh the pros and cons and explore alternatives if needed, because clarity and safety matter just as much as symptom relief. Now let's talk about antidepressants, a topic that deserves careful consideration. Some older antidepressants, particularly tricyclics, have strong anticholinergic properties, meaning they can interfere with acetylcholine, the neurotransmitter essential for memory and focus. Even certain SSRIs, while generally safer, may occasionally contribute to brain fog or slowed thinking in older adults, especially at higher doses. This doesn't mean antidepressants are harmful. They're often necessary and life-changing for many, but it does mean the type, dose, and duration matter more as we age. If you've noticed fogginess or unsteadiness since starting one of these medications, that's a conversation worth having. Together with your doctor, you can weigh the pros and cons and explore alternatives if needed, because clarity and safety matter just as much as symptom relief. Regular medication reviews are key. A small adjustment like switching to a different class of antidepressant or fine-tuning the dosage can sometimes make a meaningful difference without compromising mental health support. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. Let's talk about opioid pain medications and their impact on the aging brain. These drugs, often prescribed for chronic pain, work by binding to receptors in the central nervous system, slowing down signals, including those responsible for alertness and clarity. In older adults, this effect can be more pronounced. The kidneys and liver process medications slower with age, meaning opioids linger longer in the system. You might notice increased drowsiness, difficulty concentrating, or even moments of confusion. These aren't signs of dementia. They're often the brain reacting to the medication's sedating effects. Research shows that long-term opioid use in older adults can sometimes cloud thinking or impair short-term memory. This doesn't mean these medications are inherently bad. They serve a vital purpose for many. But it does mean that if you're experiencing new cognitive changes while taking them, it's worth discussing alternatives with your doctor. Non-opioid pain relievers, physical therapy, or even targeted nerve treatments might be options depending on your condition. The key is balance, managing pain effectively while preserving mental sharpness. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. Most blood pressure medications are essential and should never be stopped without medical guidance. But research suggests certain older beta blockers and some calcium channel blockers may have a higher likelihood of affecting memory and focus in susceptible individuals, particularly with long-term use. This doesn't mean these medications are unsafe. It simply highlights why periodic reviews with your doctor matter. The brain's delicate chemical balance can be sensitive to even slight changes as we age. Some blood pressure drugs may cross the blood-brain barrier more easily, potentially slowing mental processing speed or causing mild confusion in rare cases. The key here is awareness, not alarm. If you've noticed subtle cognitive shifts after starting or adjusting a blood pressure medication, that's worth discussing. Not to stop the drug, but to explore whether the type or dose could be optimized. Other options often exist that provide the same cardiovascular protection with fewer cognitive side effects. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. Emerging research continues to explore the nuanced relationship between blood pressure medications and cognitive function. While many blood pressure medications are essential, some newer studies suggest that certain diuretics and ACE inhibitors may have neuroprotective benefits. However, individual response often differs. Factors like genetics, hydration, and other medications may influence the effects. Of particular interest are recent findings about ARBs, angiotensin receptor blockers, which some trials associate with reduced dementia risk compared to other classes. Scientists hypothesize this may relate to their specific mechanism of regulating angiotensin pathways in brain tissue. For patients experiencing brain fog, timing of dosage sometimes proves relevant. Taking medications at night rather than morning occasionally minimizes cognitive interference while maintaining blood pressure control. Advanced monitoring through ambulatory blood pressure tests now allows more personalized adjustments than ever before. The takeaway isn't to fear medications, but to leverage growing scientific insights. Modern treatment protocols increasingly consider both cardiovascular and cognitive outcomes, ensuring optimal dual protection as you age. Always consult your physician about the latest evidence tailored to your health profile. It starts with a scratchy throat or watery eyes. You reach for that familiar little allergy pill in your medicine cabinet. But here's something most people don't realize. Those older antihistamines, the ones containing diphenhydramine or similar ingredients, don't just stop sneezes. They actively cross into your brain. Once there, they block acetylcholine, your memory's most essential chemical messenger. For younger brains, this might mean temporary drowsiness, but after 60, studies show these first-generation antihistamines can linger, sometimes causing cloudy thinking or word-finding struggles that last well into the next day. The concerning part, many people take these medications nightly for sleep or seasonally for allergies without connecting the dots. If you've noticed new mental fogginess and use these pills regularly, there's good news. Second-generation antihistamines like loratadine or fexofenadine are generally considered to have a lower risk of affecting the brain. They target allergies without the same neurological toll. This isn't about fear, it's about awareness. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. You swallow that little allergy pill expecting relief, unaware it's silently altering your cognition. New research reveals first-generation antihistamines like diphenhydramine don't just block histamine, they disrupt acetylcholine, the neurotransmitter vital for memory and focus. While younger brains rebound quickly, studies demonstrate these drugs accumulate differently after 60, with residual effects potentially lasting days. Brain scans show reduced activity in critical regions during antihistamine use, correlating with real-world reports of brain fog and tip-of-the-tongue moments. But science offers solutions. Modern antihistamines like cetirizine and levocetirizine employ molecular structures too large to easily cross the blood-brain barrier, minimizing cognitive interference while treating symptoms. Neurologists emphasize that occasional use of older antihistamines poses little risk, but chronic consumption, especially as sleep aids, may accelerate natural age-related cognitive decline. The key lies in informed choices. Always consult your doctor before adjusting medications, but consider discussing alternatives if you've noticed unexplained memory lapses. Your prescription might need updating, not for better allergy control, but for clearer thinking. The right medication should relieve your symptoms, not cloud your mind. Now let's talk about a particularly concerning category: bladder control medications. Research has shown that certain anticholinergic bladder drugs carry a higher risk of cognitive side effects compared to many other medications. These drugs work by relaxing the bladder muscles, but in doing so, they also block acetylcholine, the same neurotransmitter critical for memory and focus. Multiple studies have found that prolonged use of these medications in older adults is linked to measurable declines in cognitive function. This doesn't mean bladder issues should go untreated. Quality of life matters, but it does mean the type of medication needs careful consideration. Some newer alternatives have far less impact on the brain, and in some cases, simple lifestyle adjustments or pelvic floor exercises may help. The key is having an open conversation with your doctor about the trade-offs. If you or a loved one is taking bladder medication and noticing memory changes, don't ignore it. Bring it up at your next appointment. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. Now let's talk about corticosteroids, commonly known as steroids. These powerful medications are often prescribed to reduce inflammation, manage autoimmune conditions, or treat severe allergies. While they can be incredibly effective for these purposes, long-term or high-dose steroid use has been linked to noticeable changes in memory, mood, and even sleep patterns. You may have heard of steroid psychosis, a rare but documented condition where high doses can trigger confusion, agitation, or even hallucinations. More commonly, prolonged use can lead to subtle but persistent issues like forgetfulness, difficulty concentrating, or emotional fluctuations. The brain is sensitive to these medications, and their effects can linger even after the course is completed. This doesn't mean steroids should be avoided when truly needed. They can be life-changing for many conditions. But it does mean their use should be carefully weighed, especially in older adults. If you or a loved one have been on steroids for an extended period, it's worth discussing with your doctor whether the duration and dosage are still the right fit. There may be options to taper safely or explore alternative treatments. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. When we look at how medications can affect memory and thinking in older adults, two main pathways stand out. The first involves drugs that directly interfere with acetylcholine, your brain's key neurotransmitter for memory and learning. These medications, often called anticholinergics, essentially slow down the chemical messages your brain cells use to communicate. The second pathway includes drugs that cause excessive sedation or broadly depress your central nervous system. These don't just make you sleepy. They can dull your mental sharpness, slow reaction times, and create that foggy feeling many describe. In some cases, these effects may be subtle at first and build gradually. A single medication might cause only mild forgetfulness, but when combined with others, especially in an aging body that processes drugs more slowly, the impact multiplies. Think of it like stacking blankets. One might barely weigh you down, but several can make movement difficult. The good news, unlike progressive cognitive conditions, these medication-related effects often improve with careful adjustment under medical supervision. Never stop or change medication on your own, but do bring up any concerns. Your brain sharpness is worth protecting, and the right balance is possible. Here's the narration for the specified beat. If you or a loved one suddenly start struggling with memory lapses, confusion, or uncharacteristic mental fog, especially after a recent medication change, it's time to pay attention. These red flags aren't something to dismiss as just aging. Notice if the confusion appears worse at certain times of day, like when a medication peaks in the bloodstream. Watch for personality shifts, unusual irritability, apathy, or withdrawal that family members often spot first. Difficulty with tasks that were once effortless, like balancing a checkbook or following a recipe, can be another clue. The critical detail? Timing. If these changes began within weeks of starting a new prescription or adjusting a dose, don't assume it's dementia. Bring it to your doctor's attention immediately. Even subtle symptoms matter, like struggling to recall words mid-conversation or feeling disoriented in familiar places. Keep a simple log. Note when the symptoms started and any medication changes around that time. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is possible. Here's how you can start that conversation with your doctor calmly, clearly, and with confidence. First, bring an updated list of every medication you take, including over-the-counter pills, supplements, and even occasional sleep aids. A simple question like, "Can we review my full medication list together?" opens the door. Follow up with, "Is any of my current medication known to affect memory or thinking in older adults?" This isn't about questioning your doctor's judgment. It's about collaborating. You might also ask, "Are there alternatives with a lower cognitive risk profile for my situation, or could any of my medications be safely reduced?" These are reasonable, evidence-based questions any good physician will welcome. The goal isn't to eliminate necessary medications, but to find the gentlest effective balance for your brain. Prescribing the careful reduction or substitution of higher-risk drugs is a growing focus in geriatric care. But here's the non-negotiable. Never stop or adjust medication on your own. Sudden changes can be dangerous. Work with a doctor who understands aging physiology and polypharmacy risks. If your concerns are dismissed, seek a second opinion, preferably from a geriatric specialist or pharmacist trained in medication reviews. Your brain sharpness is worth protecting. With the right dialogue, many patients see improvements in clarity, mood, and energy, sometimes just by tweaking timing, dosage, or switching to a cognitively safer alternative. It's not about fear, it's about empowerment. You deserve to understand how every pill in your cabinet could interact with your aging brain, and what options exist to keep you thinking clearly for years to come. Never stop or change medication on your own, but do bring up any concerns. Your brain's sharpness is worth protecting, and the right balance is